this is great contrast. Female patient, late 30s, healthy. She fell while out on the town. So here's her tib fib x-rays. I think they were from outside, so I may not have like a full armamentarium, but I do have a CT scan, which I'll show you. She's otherwise healthy. Let's see if this will play. Here we go. So pain on the medial side of the ankle, and kind of it looks like an isolated medial mal fracture in a 30-year-old female. So isolated medial mal fracture. Any role for non-op treatment in this particular case? I can go back through if you want to see it again.
Are you trying to like trick me with anything
No,
in
I'm
the
not trying to
proximal
trick
fibula?
you. I'm not trying to. No, there's nothing in the proximal fibula. I did have tib fib films. Didn't see anything there.
So, I think there is. I think, there's a study, I think was it last year or the year before in the New England Journal of Medicine that showed, isolated medial malleolus fractures treated non-operatively. So I think there is a role for it. This one would be challenging to fix, and I'm going to be curious what you did here because of that comminution at the shoulder. That is not an easy thing necessarily to fix. That's a very small piece. And then, even if you kind of get it reduced, how do you keep it there? So I'm going to be curious here, but what do you think? I mean, obviously,
Well,
what we did here.
yeah, I know what I did, but I mean, I think the point being that investigating these a little bit more, kind of in some of these medial malfractures, because you can see there's intra-articular impaction. I've kind of always taken the case that if there is a marginal impaction, that I'm probably more aggressive to fix it, to try to get that lined up. But you're right. Can I really make it any better? And I'll show you what I did. I think, what I did was like fairly standard approach that you might do in something like this, but I opened it, booked it open, and put a wire in it, in that piece, and then cut it short. So nothing terribly fancy. And then I tried to use a buttress plate in this case to really raft across there. So a T plate that had a lot of different options to allow me to raft across there to try to help hold that piece somewhat contained. You can make a case to use cancellous autograft. Those are my intraoperative fluoro films, and I was pretty reasonably happy, but I remember feeling, I don't know if I made it any better. Maybe I made it different. I don't know if I made it better.
I
Curious on your
really
thoughts.
like your idea of the intraoperative K-wire here. Uh, I will sometimes use what are these like bioabsorbable pins
Yep.
instead of the K-wires, but like I think a K-wire is more powerful, like what you show here. But this is great. I mean, I really I've done this for plateaus. I'm not done it on a medial male but yeah, this looks phenomenal.
Well, I think to your point, now we have some, what I don't like about it is I never like leaving a wire in that I know is going to be almost impossible to get out. So, this is a few years old. Now they have some of these even more absorbable allograft screws, biointegrative screws that you can use to help so you don't see it on X-ray. But I think the idea, knowing that the point of this is to say, hey, this can have marginal impaction, and you have to kind of be prepared to how you're going to deal with that in these particular cases. And this was my follow-up X-ray. She never came for another follow-up, so I'm going to assume she's doing great. I actually texted her because she's works in the industry, and she's like, yeah, I'm doing fine. And this is what I meant. If you look at this X-ray here on this follow-up here, you can see this little piece there, which I really didn't appreciate interoperatively. And I kind of wish I had put maybe another screw running kind of vertically in there as well. That's my only kind of follow-up critique as I looked at it, that maybe running a screw up that way would have captured that. But overall, really quite pleased with the way this came together.
Yeah, I like what you did there with the mini frag plate. I think that's just to kind of trap it, right? That's basically what you had to do because like probably if you had put too many screws in there, you would have fragmented it even more. So I like that. It's just, trapping that piece, and it didn't really definitely did not have a place to go.
No, it didn't have. Well, and you can do the other thing I have done is this one. I like this plate because it has 4 holes on the bottom part of that T that you can use for, it's like a rafting kind of construct if you want to do that. The other thing I've done is use 2 plates on something like this that had a little bit bigger piece, one medial and one anterior, to kind of run my screws both parts. So from the side and then from front to back. to really kind of trap. But that was a little bit, it was a little bit different case, but the same kind of thing where there was all this marginal impaction, and that was just giving me a little bit more options for trapping those pieces. But mini frag, I think, in this case, not noticing like not this I can get 2/7 plate.
Oh, I think that's great, and it's going to be a little less prominent as well,
Yeah,
right? I don't think you usually need strength on the medial side for these fractures, right?
yeah,
It's just more just to hold your reduction while the bone heals.
that's right.